Hello, dear doctors, nurses, medical students, and healthcare team. How are you today? I hope you are well. Here we are going to evaluate another question about cardiology. A 55-year-old man presents to the hospital with symptoms of increasing fatigue and breathlessness over the past few days. He finds it more difficult to sleep during the nights because he is short of breath. On auscultation of his chest, basal crepitation can be heard. It means that he has pleural effusion. He has a history of chronic heart failure and hypertension. History of chronic heart failure is important, also hypertension, of which he takes regular ramipril. He is receiving AC inhibitor. Investigations were performed and furosemide infusion is given in the department, which rapidly improved his symptoms. Furosemide is a potent diuretic and rapidly improved his symptoms. The medical team decided to discharge him on furosemide orally with a specialist nurse follow-up. What is the single most appropriate medication to be added on his discharge medicine list? Okay. A. Angiotensin receptor blocker. B. Beta blocker. C. Calcium channel blocker. D. Digoxin. And E. Antiplatelet. As we said, the patient is already receiving ramipril, which is AC inhibitor, and the next best choice would be a beta blocker, which the patient has the history of chronic heart failure and hypertension. The best choice here would be a beta blocker. Here we are going to explain a little more about it. Explanation. If the patient is already on an AC inhibitor, the next most appropriate class of medications would be a beta blocker like bisoprolol, carvedilol, or nebivolol to manage his symptoms of chronic heart failure. As we said, the patient had a history of chronic heart failure and hypertension. Start with a low dose beta blocker and titrate up once the low dose is tolerated. Note, when start a beta blocker, start low and go slow. This is a good slogan for beta blockers. Start low and go slow. Management of chronic heart failure. The general management of chronic heart failure can be summarized below. Okay, first, AC inhibitor, example ramipril, and beta blocker, example carvedilol, is first line treatment for managing chronic heart failure. Spironolactone, which is a potassium-sparing diuretic, is second line. And digoxin, if the patient has heart failure in combination with atrial fibrillation, digoxin is a good choice. Both angiotensin converting enzyme inhibitor and a beta blocker licensed to treat heart failure, but it is better to start one drug at a time, either AC inhibitor or beta blocker. Clinical judgment is used when deciding which drug to start first. For example, the preferred initial treatment might be an AC inhibitor is a better choice if the patient has diabetes mellitus or has signs of fluid overload. But a beta blocker is a better if patient has anginal chest pain. As we said in the history of this patient, our patient had chronic heart failure. It's also a better choice for patients with cardiac disease. This was a short explanation about management of patients coming with chronic heart failure and hypertension. Thank you for your attention.